So, good morning, good morning, good morning. I am Dr. Amanda, and I want to begin with something many people feel but rarely say out loud. Okay. Even though you're like, you may have thought this in your mind, but didn't actually speak it out. So, if you have ever walked out of a medical appointment that you felt rushed, confused, unheard, just totally dismissed, you are not imagining it. Okay. I have even felt that way in my own appointments, and I am a physician. And I know that some of my patients have come back to me and said that they were confused, and it was like, oh my goodness, like what in the world? So like after all that, you had maybe you waited months for your appointment, and you finally like get in there, you get to sit down. Just as you begin to explain what is happening, the visit is already ending, and you're like, wait a minute, the doctor just came in and they're out already. And what happens is like, here's your prescription, here's your next appointment, and you leave, but you have no clarity of what just happened, what went on. No one explained why this happened. No one discussed what caused the condition. No one showed you how your health could actually improve. They were just like, here you go, prescription written. It's at the pharmacy. Go pick it up, and I'll see you in 3 months to see how it's working out. Um, and maybe you thought, maybe I'm doing something wrong. Maybe I lack discipline. Maybe my body is just getting older. One of my patients said I suffer from OLD. And it took me a while to get what she was saying. Like, you're suffering from OLD? I don't think I know what that is. And she was like, old. And I was like, oh goodness. And so that could be some part of it, but it's not usually always the case. But that was a funny one for you. So maybe that will break up, some of the stone face or monotony that's going on in your doctor's appointment. But like, yeah, doc, I'm suffering from OLD, and maybe they'll stop and listen. But anyway, we're gonna go through about what you can hear, like what you can actually, what you want to hear, and hear it clearly, and know that you're not failing at health. Okay. You're not failing your body. Many people are trying to heal from the inside, the healthcare system, but it was never designed for long-term healing. Like it just wasn't meant to be that way, unfortunately. And like, I see it in a lot of, like the Facebook groups and groups. When I hear people talk, they're like, doctors don't want to make you well. They want to keep you sick so they can keep making money. And I can tell you that most doctors, we did not go into healthcare to actually keep you sick, or anything like that. We actually are coming to help. And I usually try to explain that even through my telehealth, that we are here to help you. We do not want to keep you sick. And I used to tell my patients, like multiple times a day, like, if I get put out of a job because all my patients are purely healthy and I only have to see them once a year because they're just like checking in, doc, just making sure everything is good, I said I would have done my job. I would love to see that. I love to see my people like, I know I haven't been here in a while, but I'm doing well. Awesome. Yes, that's what we want. So we as physicians, I can speak for myself and some of the colleagues that I know, we are not trying to keep you unwell. We want to see you well. But the system, the healthcare system, is designed a little bit different because it is a business. Okay. So let's be honest about how modern healthcare works. Okay. So if you think about it, the average primary care visit, because I'm in primary care, I was in primary care, now I do purely lifestyle medicine, which is wonderful. But the average primary care appointment lasts anywhere between 7 to 15 minutes. And I thought I was doing well in my last job that I had. That's like, oh, we get a full 20 minutes. Woohoo. But the 20 minutes can go by quickly, and it's during this short period of time. So, I mean, some docs really have like 7 minutes, like in primary care, like, and that is to um, review the chart, address multiple medical problems. This is 7 to 15 minutes. Reconcile your medications, even if your assistant has done that already. Because sometimes when I went in, they were like, "Oh, yeah, I take this now." That's not on your list. So reconciliation, complete the documentation. It's not just like patient was here, we did this. No, it has to be like a full detailed thing. Complete documentation, because this has to meet the insurance requirements, not necessarily of what's going to help you, but it has to meet the insurance requirements. And then we have to enter the billing codes, order the labs, and also provide counseling. So if you think that you felt rushed, I always like to tell people, like, I see it on both sides. Like, I'm a patient and I am a physician. And it can be, terrifying on the other side when you're like, your doc is working hard, you have a great doc, and you'll be like, but I don't care. This is my time. I want you to stay in here. But then the pressure that the physician feels on the other side also, because otherwise they're like, you're taking too long with the patients. You do a good job to see them, but you're taking too long. We need you to see them faster. So this is the healthcare system that we're working within. Okay. So now let's consider this. You have conditions, you're seeing for conditions like high blood pressure, diabetes, weight gain, fatigue, and chronic inflammations that have developed over years, sometimes decades. Because, if you watch any of my videos, you know that chronic illness does not occur overnight. It's called chronic for a reason. It's like a lot. Yet we're expected to make meaningful, reversible changes in minutes. Okay, so this is actually done, something that's occurred over years to decades. We're expected to address and reverse in minutes. Okay, so lifestyle changes requires understanding of nutrition. It requires understanding of sleep. It requires understanding of like stress and what causes the different stressors, our movement and exercise patterns, emotional emotional health, excuse me, and what they call social determinants of health, like they want primary care, do all this, and daily habits. So just think about that on in a 5 to 7 minute visit, and every single visit that is that you come in for. So these are the things that we are expected to address. Okay, so the conversation definitely cannot happen in 7 minutes. Okay, 7 minutes, it's not happening. So what becomes the default is medication management. And I was actually talking to a friend the other day. It's like, oh, do you still work at the same place? I was like, no, I switched. And he was like, you really need to be out there, because I remember you said that most of the time people are just medically managed, and they actually can have other things that go on for them in their life, and that can actually make a difference and improve their health, and not just being managed. And I was like, I know. I know. And it's like, it's not because us physicians do not care, but because the system rewards speed rather than transformation. So think about this. So, excuse me, like transformation. So when I was in primary care, actually talking with patients, and they got better, because, like I said, that was the goal. Like, they were coming off of medication. Say like their blood pressure got better, so we decreased their medication. Their blood pressure is stable. And less medication. So maybe they had 1 and now they're on 0. So that actually makes the coding go down, right? Because they're not as sick. They're actually better. And this is where people feel like doctors are trying to keep them sick, because the insurance companies will only pay you for people that are sicker. And they're like, well, they want to keep us sick so they can make the money. But just think about that. The system is designed, not the physician, the system is designed for insurance reimbursement to give more money for sicker people. And of course, like, definitely understand that you are doing more work for the sicker person, theoretically, but because you're managing more medications, looking at the complications that can occur, the side effects that can occur from medications, that definitely can be. But also, what we underestimate is the power of lifestyle, and that actual time to take to manage the patient through lifestyle. But that is not necessarily at this point in time what our lifestyle medicine colleagues are petitioning and advocating for that not to be the case, because again, we want you to be better. So again, the system lies on speed, medical management, medication management, and I'm talking about primary care. So if you're in a surgical specialty or go to a surgeon, that's like something totally different. I have no experience with that. But just know that the faster you see people, that means the more you can see, and to get them in and out, and that's the system we work in. So you see docs that are going to different ones where their insurance companies are kind of being put to the side, like, no, we don't want to take insurance. We want to take care of the patient, we want to take care of you, and actually listen to what you need, and then actually go from there. You will see a lot more of what they call direct specialty care or direct primary care practices, which I'm a direct specialty care practice. You'll hear about that later. But it keeps the insurance company out of what makes what causes us to say this is how much you're going to be charged for something. Okay, so just to know that. So it's a system. So what actually goes on when you're actually feeling rushed through a doctor's appointment? You feel confused, you go through that, and then over time something quiet and deeply concerning happens. What happens is that a patient stops asking questions. At first, people are hopeful. They ask, can this be reversed? Is there something I can do? Do I really need another medication? But after enough of rushed visits, even unanswered concerns, enough experience of feeling unheard, people begin to resign. And they start saying, well, I guess it just runs in my family. I'll probably be on medications forever. Nothing works for me. And their hope kind of just slowly fades down. I'm like, oh no. And people are following instructions, but without expectation of improvement. And we can call this the silent resignation. Silent resignation. And that's where people are not involved in their own health. And again, unfortunately, I've seen this a lot because people come in and they're on all these medications. And I was like, why do you take this? And they're like, I don't know. The doctor just told me to take it. And I'm like, whoa, 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 whoa. I was like, I understand you definitely trust a doctor, that they went to schooling, they did schooling for this, they did extra training for this, and that you think they know what they're doing. And most of the time, I would say they do know what they're doing. We do know what we're doing. But I was like, this is your body. You need to be an active participant. You need to know why you are taking the medicine. But as more and more I talk to people, it's like it was more of this silent resignation. They're like, they didn't have time to ask questions. They felt like they would be unheard once again. They tried to ask questions, but then they're like, nope. The doctor's already had his hand on the door, his or her hand on the doorknob, and out the door. And before you even like, oh, doc, and they're down the hall, and you're like, medical assistant comes in and said, oh, we can make you another appointment if you have another question. And it's not just frustration, it's not just anger, it's just quiet acceptance that the decline is inevitable. So I was like, doesn't have to be the case. So what is missing is not motivation. What is missing is support. And so that's what we definitely want to try to support you along this way, because chronic disease decline is not inevitable. Okay. So you do not have to silently resign from your own health and wanting to be healthier. And what I usually see is sometimes too, patients like, well, I'll jump from doc to doc and like say, I'm going to come here because they say you listen. And again, going back to the top of like, if you're in certain healthcare systems and you have that 7 to 15 minute visit time frame, that your first visit may be longer and you're like, oh, finally, someone that can stay and listen. But then the follow-up visits get quicker and quicker and quicker. Like, okay, so we are able to see you for, 40 minutes today because this was your new patient appointment because we had to go through everything. But next time it's going to be 15 minutes. And next time, like, we're behind. So it's like 7 minutes. So each and every time is like the system, as you go further in, and you just keep switching providers, or you keep switching physicians, or you keep switching healthcare systems, and just to realize that it is the same thing. So again, modern healthcare is extraordinary at acute care. So there's so many things that you're like, yes. And I tell people like modern healthcare, or we call Western health care, if you have like trauma, if you have like severe infection, if you require emergency surgery, these systems perform miracles. Like actively having a stroke, there can be, like they call it door to I'm forgetting the word now. Well, they give you a certain amount of blood thinners, and they can actually reverse the clot that's going to your brain. The same thing for heart attack, a door to balloon time. I remember that when they called it. that they could actually prevent you from losing a lot of heart muscle. So these actually are excellent things that can occur. Your heart stops beating. They can get you going, give you in a breathing tube, get you some medications to restart your heart. Do shock therapy. Things like that, and it can get you going again. So again, in acute medicine, that is wonderful. But also, unfortunately, then we have the other side of healthcare where like you have these things, you're able to prevent it from getting catastrophic to where they actually pass away. Unfortunately, sometimes that does happen, but then you go to the other side of like, okay, now they don't have a severe stroke to where they actually die. They have now partial paralysis, and now become a chronic illness, or you had heart disease that built up, and like you had stents placed, but now you have chronic heart disease. And for the chronic disease, our systems weren't kind of built for this. So people are living longer because of this acute healthcare system, but people are living sicker. Okay. So chronic illness, again, develops slowly through lifestyle patterns, metabolism, stress physiology, sleep disruption, and just environmental things. Okay. Yet when we are using an acute care model to treat chronic disease, you see how that wasn't going to work, right? The system was built to diagnose and stabilize. It was not built to guide transformation. And that's what we need in chronic disease. We need transformation. We need reversal. But again, the modern healthcare system was not designed for that. So when healing does not occur, sometimes we as patients, like I said on that side, patients can blame themselves. But often it's the limitation is structural and not personal. Okay. So again, there's so many things that go on in the healthcare system. And again, there's good things that like healthcare, if something's going on, you can get in and do well. But chronic illnesses, we just definitely need to work on. Okay. And again, that's what most primary care docs were dealing with. So with real healing, we want to require four things for real healing. Okay. So let's look at those. So the first would be time, because we talked about how our appointments are 7 to 15 minutes. So we need time. We need behavioral change cannot be rushed. Okay. You can make the changes for a week, a month, sometimes even for a year. But if it's not really sustained in conviction and total transformation, then those behavioral changes kind of slowly goes backwards. Okay. So healing happens through understanding and repetition. Okay. So you have to have the time to change, the behavioral changes that occur, and then also that actual understanding, repetition. Do something, correct it, do something, correct it, do something, correct it. And for those that don't know my story, like this has been over now 3 decades of me working on my health and wellness. And so for those that know, I was an obese teenager, likely had insulin resistance, probably some pre-diabetes or close to like diabetes, because I look back at pictures and like I can like see some of the signs on me, and I'm like, ooh, and so those things, I had to make some behavioral changes, and actually learned things I actually could do to actually improve my own health. So the behavior changes that are still occurring over 3 decades, again, time and understanding with repetition. The second thing was education, actually understanding what's going on in your body. Okay. So when people understand how foods affect your blood pressure, how sleep affects your hormones, how stress affects the inflammation that's going on in your body, that motivation can change. Like you understand, like I know what's going on, the result, but I didn't know the deeper, like the root cause, like what's actually going deeper. And that education can actually help you to restore your ownership of your own health. Okay. Third, we want to actually look at continuity. Okay. So transformation happens between visits, not just during your appointments. So I tell people, like, I can easily write you a prescription and you can go on about your day, and we can, finish up this, 7 to 15 minute visit in 2 minutes, because, that's all we're going to do. But I'll be more than happy to discuss with you, things that you can do in between our appointment times that can actually make sustainable changes in your health and not just this medication that you're going to tell me causes too many side effects. Did you see this, Dr. Amanda? Did you see all the side effects that this can cause? And you expect me to take this? What? I get that. I have got that a lot. And I'm like, yeah, but then you said you had, bacon for breakfast. Like, where's the side effects for the bacon that you have? Like, look at those. Like, that's what I'm going to try to tell you. Like, which side effects are you taking? Like, so we're going to have our leafy greens, our oatmeal with some flaxseed. We're going to have bacon. Are we going to have, a torvastat? Look at all the side effects. We're going to look at all these equally. Okay. Let's look, let's not, just go on our pharmaceuticals, but these are things, I just try to do to lighten up the mood for patients, because sometimes it can be overwhelming and very intimidating to be in the office because of the way the system works and you feel like you're unheard. But again, we want to look at those things. So the transformation happens between visits. So we want to be looking at, what we're doing that's causing different effects on our body. Okay. I love to make people smile and laugh. They're like, oh, okay. So I try to say relax, so you can say relax. We gotta work together, right? So that was the third thing, continuity of care. So you want to keep going back. Don't feel like you cannot talk with your doctor, let them know what's going on. And then definitely, even if you kind of like missed the boat. So say you set goals before you left your appointment, which we do in lifestyle medicine appointments. Just so you know, we set goals before you leave and know what we're looking for the next time. So it's you reach none of your goals, right? Say, Dr. Mann, none of them were hit. Or maybe you hit 2 of the 3, whatever it may be. Don't be afraid to come back, because coming back gives you that positive reinforcement that you need. Said, okay, well, good. Let's see what kind of hangups did you have? What prevented you from reaching this goal? Was it, too ambitious? Was it, you had to make too big of a jump? Maybe you were trying to be, Olympic long jump person instead of just taking the next best step, right? So that's what we'll do. We'll look at those next best steps you should take instead of like going too far out. Okay. So if you actually have that continuity of care, and then that relationship, that's number 4, that relationship that builds between, yourself and your physician, then that actually makes you feel heard. It makes you feel like healing can come, and patients like you can feel more supported rather than they're just managed by more and more medication. Okay. So some of you already know you need a different level of support. You're just deciding when to start, right? You're deciding when to start. So if today's message resonated with you, so you felt rushed, you want to feel heard, you want to have the continuity of care, you want to have the relationships, I want you to know that there's another way to experience healthcare. And I, Dr. Amanda, have built a virtual lifestyle medicine practice with Atkins Enlightenment Lifestyle Medicine, where we specifically help individuals who want to be, who want their care focused on root cause rather than a rushed symptom management appointment. Okay. We don't want to like you feel rushed. We don't want you to feel like you're not heard. We want you to actually feel heard and want to actually partner with you to actually help. So we focus on nutrition, metabolic health, blood pressure, blood sugar regulation, looking at your sleep and your stress physiology, and sustainable lifestyle changes. Because again, we can make some behavioral changes that we can do for, a few weeks, 40 days during Lent season, or we can do it for a lifetime. Okay. So we want to make sure that you feel supported, that you can keep these changes up for a lifetime. Not perfectly, but reaching for consistency. Okay. So this is a personalized relationship-based care designed around healing and not billing codes. Okay. So if you're ready to have a different healthcare experience, please visit us at www.dramandamd.com. You can schedule your consultation with me, with our lifestyle medicine practice. We are licensed in 10 states, so you can see if you're one of those people in the 10 states. If not, then reach out to me and we can see another option that we may have for you, okay? Now, the people who experience the greatest health transformation are usually the ones who decide before everything gets worse. I'm going to say that again. The people who experience the greatest health transformation are usually the ones who decide before everything gets worse. So imagine something different. Your appointments never feel rushed. You're starting to understand what your body needs. You're not fearing your lab results. You're not feeling like you're unheard. Imagine hearing that medications are being reduced. They're being reduced. They're being taken away because your physiology is improving. That inflammation on the inside is decreasing and starting to reverse. Imagine your energy returning, your confidence returning to actually be able to discuss and have this relationship with your physician, your hope returning because you're feeling better, and healthcare working with your body instead of reacting to crisis after crisis. Whew. So if you've been waiting for the right time to truly focus on your health, this may be the moment you've been waiting for. So again, if this message helped you to see health and healthcare differently, please take a moment to like this video, share it, tag your friends and family, someone that is feeling discouraged in their healthcare journey. Please share this with them and, tell them to reach out to me at www.dramandamd.com. I'll be more than happy to help because many people still believe they are failing when in reality, they were never given the right system to succeed. So blessing and health to y'all, and I look forward to seeing you next time.